guys, it's Jen. I decided to make another video today just because I just found out some great news that I'm going to share with you at the end or towards the end of the video. But I'm really going to go ahead and talk about kind of the process I went through after I talked to my gynecologist and what consultations I had to go to that led me up to this process before I had the surgery. So, before I get started, I just want to thank you guys so much for sharing the BRCA t-shirt video link and buying more t-shirts and making generous donations. Thank you so much. And just keep sending it out there, send it out to the community, build up that awareness, and just remember a portion of those proceeds are going directly to a cancer patient. Deadline is November 13th, so buy your t-shirts. Get it out there, and we really appreciate all your help, guys. Thank you so much. So to start off my video, after I talked to my gynecologist, I really told her that I did my research about this gene before I even got tested. I waited a year before I got tested to do research and you know, what type of options were out there if you tested positive, just to kind of prepare myself. Being prepared is the best thing you can do, so it's not so much of a, oh my God, like a shock. You kind of have a plan to go by if, you know, worst case scenario, you do test positive. So I went first to go see a oncology breast care specialist. And from those of you from Connecticut, her name is Dr. Polikoff, and she is located in Southbury. She is the first one I went to go see. She just sits down with you and she goes over all the options from the least invasive to the most aggressive, which is observation and then the surgery. She described like 50 million type of mastectomies that you can get, and I'll make another video describing the type that I'm going to get. But anyways, what I liked about her was she's very thorough. She sits down with you. She's very nice. She makes you feel very comfortable. And she does. She tells you like it is. She was a little leery at first because I'm 25 and I'm making such a huge decision at a young age. And she really made sure that I was mentally prepared to make this decision. She said maturity is a big part of this surgery. It's not just, okay, oh my God, I tested positive, get these things out of me right now. She wants to know that you are prepared to make this decision, because it does alter your life in the long run, like I said before about breastfeeding and all that stuff. So she wants to make sure you're not making a split decision just because you're positive. She wants to make sure that you're really, really mature about making this decision. You're ready to make the decision. So after talking to her, we agreed that the mastectomy was a good option for me based on my family history, and I was adamant about getting it. I was like, I want this surgery. I don't want to mess with it. I don't want to give cancer a chance. That's my thing. I do not want to give it a chance, and I made that clear to her. I'm 25. I'm an adult. I can make my own decisions, and I feel very strongly about it, and I made that clear to her, and that showed her that I was very mature and that I knew what I wanted. I was there through my mom's surgery helping her, so I saw firsthand what the surgery is about. I'm a nurse. I took care of patients who had mastectomies before, so I was very familiar with the surgery. So after that, she did a clinical breast exam on me, and then she decided to have me go for an MRI just to make sure nothing was there, no surprises. So if they do go in for surgery, if they see anything, they would have to biopsy it and all that stuff. So they just do it as a baseline imaging, because as a 25-year-old, we don't go for breast imaging. We don't get mammograms or ultrasounds at this young of an age. So thank God my MRI came back clear, no signs of anything abnormal. So from there, I decided with the mastectomy that I'm going to get reconstruction. So I had to go see a plastic surgeon. And she recommended I go see Dr. Sunny Waits, which is also located in Southbury. And she is so phenomenal. If I have to recommend a plastic surgeon, she is it. She will make you feel so comfortable. She is just an awesome person. I'll get more into that next. But when I went to go see the plastic surgeon, I walked into the office and I walked into the exam room, and they have you put on this robe, obviously, because they have to examine you, look at your breasts, see what's best for you. And on the table, you see all these different implants, and some are different shapes, some are different like materials, some are thin, some are thick, like, oh my God. And you're like, holy crap, what is this? And it kind of hits you. You're like, oh my God, this is so nerve wracking. Like, what am I going to do? There's so many options, but it was so funny, like, just as a side note to make this like less serious. Me and my mom were in the exam room, and you see all these implants, and the first thing you want to do is you want to, I mean, come on, you want to touch them. Like, so me and my mom were picking them up and we were squeezing them. We were like, oh my God, like feel this one. Like, oh my, like, it was like, oh my God, like, I don't even know. I can't even describe it. It was so funny. Like, they're big, they're small, there were so many different kinds. So I'm like, oh boy, like, I'm leaving this all in her hands. I have no idea what's going on about that. But she does. She's very real with you, and she's very personable. She's very laid back. I've never met a doctor like that before. She comes in, obviously she knows my mom because she has done my surgery, them two, Polikoff and Dr. Waits. And she was like, hey girl, what's going on? What the hell's going on? You guys are positive. What the hell? Come on. Like, she made me feel so comfortable. And when it came down, she was like, very nice at first, but when it came down to business about talking about the surgery, what type of implant, like, she got like in her zone. She was like, all right, this is what I recommend. This is the type of surgery I recommend. This is the type of implant I recommend for you. And I really wasn't that picky because I don't even care about the size of my implants, what type of implants I get. I'm leaving that all in her hands. I just want my breast tissue gone to not even give cancer a chance. That is my main goal. She said, like, people come in here and she's like, yeah, they're an A cup and they want to go to a double D. And I look at them and I'm like, yeah, that's not going to happen. I guess a lot of people are picky nowadays. And, and one thing she said to me, she was like, people think because we're plastic surgeons that we're God and we're perfect and we can make them look phenomenal. But she goes, we're just doctors. And that kind of really meant a lot to me because she's not there to get your money or like, okay, let's do surgery tomorrow. Okay, you want to go bigger? You want to be a D cup? All right, let's do it. No, she cares about you. She recommends what's best for you. And if you recommend something that's really out of line or really not going to work in your situation, she will tell you and she won't do it because she cares. Her license is on the line. And that really meant a lot to me. When it came down, she did again say that I was very young for having this surgery, and she made sure that I was ready for it, and she agreed. She said, all right, let's do this. And the good news is I just got a call this morning, and my surgery date is going to be November 4th. So keep that in mind. I am going to make another video for the type of surgery I am going to get, just so you guys, have, like I said before, there's a bunch of different types of mastectomies, but I'm going to describe the one that I chose, why I chose it, and what I'm going to get. So keep sharing the BRCA t-shirt videos. Thank you guys so much again for your donations and your purchases. And I will see you guys soon. Bye.